This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
We want you to know that just because it's Labor Day weekend, that doesn't mean we're not here, okay? We are and happy to be here. Good morning and welcome to the show, the Labor Day weekend edition of Health Watch, every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. What do we talk about here on the show? Of course, Dr. Molly Fantasia, as you heard the man say, is here, the PhD doctor, executive director, and founder of Innovative Medical Associates in Marlton, New Jersey. And we talk about what Dr. Molly does, how it can help you and anyone you know improve your overall quality of life. And we talk about a lot of things here on the program, so we invite you to stay tuned. And, of course, if you have a question for Dr. Molly, and many times people call in with some medical challenges that they have, and you want to discuss that with Dr. Molly, our phone lines are open at any time at 855-839-1210, 855-839-1210. And again, that's our number here in the studio. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly, happy Labor Day.
Hey, same to you, John.
We're here as per usual.
End of summer for lots of folks, but a good time to start thinking about fall and winter and staying healthy. I'm still hearing so much more about COVID, as you know, John.
Yeah.
And my patients are coming in with a lot of questions about this new COVID variant and how can they get through the winter and will they be at risk for flu and everything else out there. So
exactly. You get inundated with questions every week.
Well, I really think this is the time of the year. Summer's done. I hope everybody got out and enjoyed some of this after the year we had. But now's the time to really think about your own health and how you're going to get through the winter months and also get yourself back in shape for spring. And I want you to have a good year.
Which leads to the question, what you do and how you do it and why you do it. So explain Innovative Medical, what, why, how.
Sure. Innovative Medical is easy to explain. We are a cooperative of like-minded healthcare providers who work out of our facility, which is a primary care facility in Marlton, New Jersey. But we're a little different. So if you need a primary care situation where you need an antibiotic or you need a blood pressure pill, or for that matter, a cholesterol medication, can my medical director prescribe that for you? Of course he can. However, our philosophy shows that we want to use the least amount of the pharmaceutical to do the job, augmenting that through a natural substance like vitamins, minerals, and amino acids, kind of thing you might get at the health food store. But the way we deliver it is through the hydration.
And the hydration is more potent, more effective than the health food store.
In many cases.
Right.
And many times we'll also advise you on some oral products that you could get from the health food store. But what we don't want you to do is go into the health food store and spend $500 and not get your money's worth.
Right. And get $400 worth of the same thing.
Right. Or things that don't work synergistically together. So you do need advice in that. Now, there are good health food stores. Don't misunderstand me. You know I have a patient who runs a great store. But there are other places that you go in. And actually, Dr. Molly had that experience yesterday. Interesting. I was looking for a specific product. You know how I am.
Right.
This kid comes out from behind the counter and he's telling me what I should buy. And it was great. It was nice. I was pleasant. But I wanted to listen to him. And I thought, after I told this guy a few challenges that I was having for this product, he leads me where? To a particular brand that they were pushing that week. that I did not want. And so it was a real life experience of what we talk about on this show.
We say this all the time, and,
honestly,
and it happened to you yesterday.
Yeah, and this is a chain store, so, no hard feelings. I went in and I got the product I wanted. I saw it clearly on the counter. Not him. He was pushing me to something else. And then he was telling me, you need some other amino acids. I said, I do? Okay. And he gives me a list that none of them had relevant to what I was looking for.
Little did he know who he was talking to.
At the end, he saw my credit card, and he said, "You're not that Dr. Molly, are you?" I said, "Yeah." He goes, "Oh, well, thanks for coming into our store." I said, "Yeah, I was delighted." What can I say?
Yeah, but that's exactly what we talk about all the time.
Exactly. And that was a good life lesson for me because, it was interesting. Normally I have the stuff sent to me, but I ran out this week and I wanted to make sure I stayed on it. The way I prescribe it for other people, or the way my doc prescribes it for other people, is exactly the way I want to take it, particularly when it concerns enzymes and probiotics. So that was the issue. But again, John, we can do anything a primary care facility can do, but the real core of what we do is we want to use God's ingredients as much as possible.
And that just brings me to remind everyone about your book, God's Ingredients, TOO, My 30-Year Journey.
Thank you.
In IV Nutritional Medicine, and that is out recently. In fact, Dr. Molly has a copy with her today, and you can purchase it on Amazon.com or anywhere you can purchase books. God's Ingredients, TOO, thought it was an appropriate time to mention that.
Thank you, John.
Talking about your hydration therapies.
Sure.
And talking about the differences between that and what you can get in the health food store, more potent, more effective,
specific,
more specific,
for
exactly.
a patient. And again, it takes some thought, John. We don't just throw something. Sure, you can go to spas, you can do all that. You worry about your anti-aging. I'm not worried about anti-aging. I have a line of skincare, right?
Yes.
Anti-aging. But I'm worried that I want you to look good and feel good. And that really is the crux of the matter. So I want you to have not just anti-aging, I want you to have longevity.
And that's really what you're about. That's
quality
really
of life.
Quality of life and longevity. And we're going to talk about that later on in the show. That you hear all of these spas about anti-aging, and all these creams and so on and so forth, and
vitamin C. Everybody, they're giving you vitamin C, but that's not enough, right? Particularly today. I mean, I see people who want to really age well. They want to age well, and that's the key.
What can people expect when they start the treatment? And I was talking to one of your patients this week, and
Dave.
Dave.
He's a great guy.
Talking about starting, and he would like to continue. He feels good, and I was telling him just what you always tell me, that it's the reserve that you want to maintain. Right. I said if you stop for a period of time, you got to start over again.
Well,
basically.
Here's the thing. You don't necessarily have to continue to go steady with me, right?
Right.
But you need to have a program put together, and actually he's coming up on that period of time. Now, he came to me, though, I want you to understand, he came to me with some comorbidities, right? Yes. Which he said himself.
Right.
So we have really addressed those and have effectuated change, metabolic change for him. And actually, he went ahead and retired over it because initially, and he said, but now I have a lot of energy, Dr. Molly. What should I do with it? I said, become a consultant.
Exactly.
And he
right.
laughed. He
exactly
laughed.
Right.
But it's right. That's true. So the question is, you go to a maintenance, and the maintenance can be anywhere from people who have very, very serious conditions might come twice a month. People who don't have that serious, they might come in once a month or once every other month. But really, the idea is you want to maintain that level of antioxidant level and that level of I would say, nutrition specifically for the problem that you had. For example, if you came in with a cardiac problem, which is what he had, I want him to maintain the cardiac nutrition, right?
Yes.
And that's the deal, John.
So I think the point is that if you stop completely, then you have to start all over again eventually.
Right, eventually. But the question is, can you go on vacation?
Sure.
You've done that.
Right.
Can you, stay away for a month because you went to Europe, although it's not so good to go to Europe right now, right? Okay. Yes, I've had people. I have patients who go back to Italy. They have family there. right?
Yeah.
So, yeah, they come back in a month and they come in. They may come in a couple of times in the week they get back, but then they go down to once a month. So, yeah, there's ways to do this, and we will help a patient and guide them in that regard.
We are coming up on our first break of the morning. The show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey. Plenty more to talk about here on the show, but we always tell you at this point in the program that, you want to call in so Dr. Molly can take some time to discuss your situation with you. Call in early, 855-839-1210. We always have a couple of calls at the end of the show, and we've got to rush them in. So you can call early and make sure you get everything taken care of. 855-839-1210 is the number. I'm your host, John DeMasi, with Dr. Molly Fantasia. We're returning. More of today's Health Watch after these words. Back here on Health Watch, operators standing by right now at Innovative Medical Associates. And as always, they're happy to take your call, your questions, and you want to make an appointment with Dr. Molly. The initial consultation is complimentary. The number is 856-489-0505, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey, and, of course, the website, innovativemedicalassociates.com. innovativemedicalassociates.com. A lot of good information on there as well, so you check that out. But call and make the appointment. As we've always told you, the initial consultation is complimentary, and that's really where you can get a lot of your questions answered by meeting with Dr. Molly. 856-489-0505. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Again, our number, 855-839-1210. That's our number here in the studio. And another great story, Dr. Molly, about a husband and wife, and literally
the team
saved his life, huh?
I think so. The team really came through. It's this COVID thing has been monumental, as you know, and it's not over yet, folks. I mean, people are so worried about the new variant, and the long haulers are worried. But this is an interesting case because the wife is actually in holistic medicine. She actually does some holistic treatments at a particular type of treatment, including energy work in Delaware. Anyway, I spoke to her the day she came in, and she certainly didn't look good. So, of course, we immediately went into our COVID protocol, which means she was isolated from the other patients and she was by herself, and it was in a particular room that we then clean and de-COVID, if you must know, the whole deal. But what was interesting was my nurse, I said, listen, throw a pulse ox on her. And it was slightly diminished, not completely. But in the course of this conversation, I find out that her husband was too sick to come into the office. So we ran a quick COVID test on her, an antigen test, which actually showed whether they had the antigen, which is the invader. And indeed, she was positive. Now, she had started, we put her on an IV, our COVID protocol. In the meantime, I insisted that her husband go to the hospital. Called her home. She called her home. He didn't want to go. He said he was okay, blah, blah, blah. Story. Now, you know these people, actually.
Yeah, okay.
Okay. And it's interesting. Resistance. He was home. He was doing everything right. Guess what? She called their son. Her son went over, said Dr. Molly and the gang, and her doc said, you must go to the hospital. Son took off from work, drove him to the hospital, and am I glad they did, because his pulse ox was 5 points lower than hers. So he was having a difficult time breathing. He just didn't realize it. Okay? He didn't realize it. And we
It's
knew
interesting. How do you not realize you're having trouble breathing?
Well, because you feel like, it's just part and parcel of sinuses. You feel like you're under the weather. You may have a slight fever, a little harder to breathe, but you feel like you're okay, especially if you're in your 50s. You feel like you're good to go.
Yeah.
Right? Well, guess what? He gets admitted to the hospital. She, on the other hand, she's sitting. Now, I'm not saying this is a remedy for COVID. She's sitting here, and I said, listen, I want you to go to the hospital immediately after this, because a friend of her drove her to the clinic. Are you sure? What are they going to do? I said, I don't care. You're going. They have the antibody treatment, right? And you need it. Anyway, she leaves the office. We tune her up. Her pulse ox was very stable. My nurse said she's quite stable. We sent her to the hospital. The hospital rehydrated her again because you lose a lot of fluid when you're sweating. When you have rehydrated her and sent her home, they kept her husband. So she calls me later, and her friend, who is also a patient of mine, said, Dr. Molly, you and your gang really saved his life potentially. I said, well, and maybe hers too.
How about that?
That is a true COVID story. Now, let me assure people out there, my listeners, that if you don't think we decontaminated that room, rest assured we did. We followed COVID protocol to the T. My gals were in their COVID, garb, as well as we made sure that entire room. And I have Nurse Barbara, who is a bear on infection control, and we isolate patients. But this goes back to what I said before. How do you not treat people? How do you just say, oh, well, we're not going to treat you? You just can't do that, John. What's wrong with us today?
Is that actually happening? That people
say they're turned away, that they
because
won't take
COVID?
Yeah, they said they're not sick enough. They're not sick enough. Well, in my mind, if you have a little touch of something like this, guess what? I want to help you. That's all. I want to help you with whatever we have.
That's a new one for me, where people say you're not sick enough.
Well, it's true. It's true. So that was an interesting story, and that happened because, again, we're seeing a lot of long haulers too. People who really test positive for the antibodies because they've had COVID, but they have all of the side effects of COVID, including just the dysregulation hormonally. I mean, it's amazing. I'm seeing men whose testosterone plunged 100 points, John. Isn't that crazy?
Wow, that is crazy.
They have a lot of hormonal dysregulation, a lot of biochemical dysregulation. The fatigue is phenomenal, and we can help people through that, and will.
Let's talk about your protocols, and we've often talked about prevention. And I was thinking about this because you've talked about your hydration protocols as antioxidants and that kind of thing. Prevention is the key.
Right.
And that's a lot of what you do.
If our own immune system, listen, our cells are powerful. God's given us a very powerful immune system, but we have to maintain it. And unfortunately, what happens? How do you lose some of your immune health easily? Toxins, right? We have environmental exposures every day. Well, guess what? You got to come in for a tune-up. Antioxidants are very, very important in that. Also, homeopathics. There are many ways to deliver homeopathics, and we use a hydration vehicle for that. You've got to be fairly skilled in that. But yes, amino acids. There are certain amino acids that are a lifeline to your blood cells. So guess what? To the mitochondria. And what's the mitochondria? The powerhouse of the cell. The journey of the cell is the thing. And I talk about that in the book. And it's something that people should be aware of. And again, this isn't big science. I don't sit around and talk about every chemical reaction. But we know that by giving people good extracts of vitamin C, giving people God's ingredients, we tend to help them get through these particular conditions and get to the other side, John.
I've often told you here on the show that I feel it myself. I feel a lot of times like something is trying to come on, and I feel like it just somehow it goes away, like it's not there for very long.
Well, let's thank God, because you have comorbidity, so your body's always in a state of fighting something, right?
Yes.
What I want to do is get you back to homeostasis, which is the balance, the ability of the body to really, or an entity to really make themselves heal. All right. And that's really the philosophy of our clinic. Interestingly enough, vitamin D3 is very important through this COVID deal. Very important. And I really, in my heart of hearts, I believe that the levels that are being tested, the reference ranges are too low for most people. Not all people, but
and
most.
Your nurse, Barbara, who is always giving me lists of things to get,
yes,
said to me, zinc and vitamin D along with the vitamin C, and I take that.
Yes.
I take that every day.
Oh yes. And there are other things. There are the homeopathics that are the antivirals. There are extracts that are antiviral that God has given us. My belief is I'm using a lot of the honey that I'm getting from the Holy Land. Very high in antioxidants and homeopathic plants extracts, so that the honeybees extracted this from particular flowers, and so it's very high in nature, and we have that. There's a lot of things that we should look at, John.
What can people expect? And I've asked you this a lot of times, and it bears repeating. What can they expect in terms of length of treatment? In other words, I go twice a week, and I have comorbidities, and we talked about that.
Right.
But what can normally people expect?
Well, if people are in good shape, if they're in good shape, they can expect to be in better shape within 5 weeks if they do it the way we ask them to. In other words, when I say better shape, I mean be able to have more stamina, actually continue their regimen of working out, whatever it is that they like to do. Look, quality of life is what we do. That's it.
Right.
I want to improve your quality of life. And so we have a protocol for that. We have a well protocol for that. That includes exactly what you said, vitamin C, certain B vitamins. But again, it depends on the patient.
And the patient really follows that. And in addition, you talk to them about getting some supplements.
Exactly.
Which, as I said,
exactly.
Barbara gave me a list one time, and there was...
But you know why that list was that long?
Yes.
Because we were battling two pretty serious conditions at that time.
That's right.
So, would we revise that list for you? A little bit. And we have. Look at how good you've done through this. I don't want to... As I say, I don't...
You don't want to jinx it, right?
Right, and I don't... And I believe that really God's in charge. But look at all the people that have managed. We keep focusing in on the people who are getting COVID. How about the people who aren't?
That's right.
Right?
That's right.
How about the healthcare workers that aren't? And there are a number of us. Thank God in my clinic, all of the clinic people have been doing well. Our particular group, the list that you say hello to at the end of the show, they're doing well. And why? Because we follow what we preach.
And I know you've had a lot of extra procedures being done over this whole period of time.
Oh, yeah. I have the men's health that's been in full gear. So again, hydration plays a part in all of that. Hydration as the vehicle, but it's what we put in those bags that count.
Coming up, we are at the halfway point of the show. It's Health Watch, Sundays 8 till 9, Talk Radio 1210 WPHT. Our number here in the studio, and we have some open lines if you want to jump in. Good time to jump in with a question. 855-839-1210, 855-839-1210. It's Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Coming up, we've been mentioning Dr. Molly's book. After the break, we got another great story from the book of Dr. Molly with a patient who's been a patient a long time, and his story is another real testament to Dr. Molly and her staff and the work that they do. 855-839-1210. Health Watch is the program. I'm your host, John DeMasi, with Dr. Molly Fantasia. We return. More of today's show after these words. We are back here on Health Watch. Operator still standing by. Listen, as we said, Labor Day? No, there's no Labor Day with the operators. They're there. 856-489-0505. That's the number, 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey. You can call now. You can call after we leave you at 9 o'clock. You can call during the week. You can call tomorrow. It's a holiday. You can call. They're there. All right. Yeah. No, as I said, no Labor Day for them, right?
Yeah, actually, John, we're working right through Tuesday through to Saturday, and we've started our Saturday hours again.
I was just going to mention that. Good. Okay. 856-489-0505 is the number. InnovativeMedicalAssociates.com is the website. InnovativeMedicalAssociates.com is the website. Health Watch is the show. Sundays 8 till 9. Talk Radio 1210. WPHT. Let's go to the phones. Don is in Levittown. Don, good morning. You're on Health Watch with Dr. Molly.
Hi, Don.
Hey, good morning. morning. I was going off of Doug Sittel, Sittel on Google, and the YouTube.
All right. Thanks for the call, Don.
I
We
know,
appreciate
Don. Take care. He needs a lawyer. How many times are we going to tell this guy this? But it's good. It's good. I'm glad he called.
All right.
And God bless him, whatever he is.
855-839-1210 is our number here in the studio. Legitimate calls we're happy to take. 855-839-1210. Let's talk about Harvey.
Yeah.
You chronicle his story in your book.
I do.
I know Harvey because he's been a patient for 18 years. I've been a patient for 20.
Right.
So him and I have sat together
Side by side.
many times
Yep.
and discussed life and all of that stuff.
Hey, listen, he's a successful guy.
Yes, he is. I know
He's a
he
very
is.
successful guy. And he's also, by the way, he's a Marine. And once you're a Marine, you're always a Marine.
That's what they
as you
say,
know.
yeah.
So the thing about Harvey that's interesting is he came to me he had an addiction problem of drinking. And he'll be the first to tell you that. That's why I can say it on the air. And unfortunately, alcoholism is a sickness. It really is. It's a very big devil. But he kicked it himself. But in doing that, he had a stroke. And of course, he wasn't in the best condition when he started with us.
Yes.
And we found out that he actually had a lot of the comorbidities that are most associated with alcoholism. For example, cardiomyopathy, which means your cardiac muscle has been damaged. He had an ejection fraction of about 20, maybe 15 to 20 at the time, which means he couldn't even walk across the hall. Couldn't do it. He had some shaking. I mean, he had so many comorbidities. It was just he had lung capacity issues. And he was also, by the way, a big smoker.
Oh, boy, I tell
So he
you.
came to us with a serious issue of these addictions. And I had a very special interest in this because my own sister had this problem. And by the way, she is in the good Lord's hands now and really passed away at 60. So believe me, Harvey was fairly young at the time. He wasn't 60 at the time. And unfortunately, this alcoholism is a devil. But we put Harvey on a protocol, and believe me, he followed it to a T. Part of the reason was he had a very wonderful wife who also was a patient.
Yes.
She became a patient. She heard us on the radio 20 years ago.
Yeah.
They heard us on the radio 18 years ago. Isn't that something,
Yeah,
John?
how about that?
Yeah.
Huh?
And
That's
so,
how long we've been doing this.
Oh, yeah, in one form or another.
Right.
That's right. And interestingly enough, Harvey was very cooperative. He worked closely with my physicians. He actually he doesn't follow such a good diet even to today. So we knew we were going to have some challenges with this. But I can tell you that once he made up his mind to quit the drinking, he did. And as a result, we were able then to actually utilize our facility and giving him the hydration specifically twofold. We had to really address each and every of the comorbidities, which again were numerous. We had to address lung issues. We had to address cardiac issues. We had to address the overall nutritional status of our patient. And we also had to address him to make sure that we could bring his own immune system up to par, because what was he could be infected with any virus, with any kind of bacterial infection, and we had to really look after him from a primary care point of view, which God bless my medical directors. So what we did was we put him on a program in the beginning almost for 4 times a week. Ultimately, within a year, we dropped him down to 3 times a week, finally dropped him down to twice a week, and now he comes in once every other week. And I will tell you that he is a different guy. But interestingly enough, what we do before, what kind of challenge we have before we come in, always with us. I don't mean the addiction. I'm talking about his health, the status of his health. So what happened to Harvey? He got COVID.
Oh, wow.
Okay. He got COVID. Why? I can tell you why. His immune system was permanently compromised from his lifestyle, right?
Yeah.
Bad food. His wife unfortunately passed away. he now was, he had all of the grief, he had all of that anxiety, all of those things contribute. And I kept telling him, look, Harv, you got to come in a little more often right now because things are, no, Molly, I'm depressed. Depression got a hold of him. Guess what? He gets COVID. He came to see us. This is back now a year ago, right? Because, this is the early stages of COVID. We knew he had COVID. Send him directly to the hospital. I said no. And by the way, he wouldn't answer the phone. Oh, once I told him he had COVID, he wouldn't answer the phone. Now I see
like it's going to make it go away.
Oh,
right?
yeah. And so I didn't even put this in the book, but it's an interesting story because this will tell you how far I will go if I know you well. And listen, I love all my patients and they're special to me. And if I can help, we're going to help. Even to the detriment of my medical director who's like, hey, Molly, if the guy doesn't want to, no, we're going to do it. He goes, okay, you're in charge, right? I'm in charge medically, but you're in charge of getting him to the hospital. I said, don't worry, I will. His nephew, I called his nephew who's working in his business. His nephew said he won't go. I said, listen, send one of the guys over there right now. I'm calling his lawyer, who happens to be a patient of mine too. Guess what? The lawyer called 911 and said he had his medical directive. He went to the hospital. His lawyer called me and said, thank you for saving his life. And when Harvey was back in his right mind, he thanked me for saving his life.
Yeah. Well, I can attest to Dr. Molly will do anything for her patients. You did this twice. You came to a situation where I was in really bad shape.
Oh, I remember.
But the second time you did it, Dr. Pat was concerned about blood clotting. So she said, go to the emergency room right away. And you came with me. And I'll never forget the nurses looked at me and they said, well, who is she? I said, that's my doctor. The nurses said, your doctor comes with you to the emergency room? I said, well, this one does. So that's that.
Well, I didn't present myself as your doctor.
I
you
did.
But
yes.
I presented myself as owning the clinic that you come to.
Right.
And I said, yeah, okay, I'm his advocate today. And that is the truth. I mean, we really want to advocate for our patients. And more, John, under today's health system, you want to have an advocate, but you want to have an advocate that understands you, understands who works closely with your other physicians and all of everything that's going on in your personal life.
Okay, we're going to go to the phones. We have Anthony in Ventnor, New Jersey, enjoying the shore for Labor Day. Anthony,
hey, Anthony.
Good morning. Welcome. You're on with Dr. Molly.
Hi, Anthony.
Thank you, sir. Hi, doctor.
How are you?
I'd like to know, how do you fumigate a room or an apartment from a person who has had the COVID?
Whew, that is it. Well, if you're talking like in terms of my clinic and what we need to do, for example, we have a room scrubber that is very important to exchange the air. We exchange all the air. We have a filtration system on the air conditioner and the heater that's unique to healthcare so that we can maintain the particle. The other thing is you really got to wipe everything down with the antiviral rags and the antiviral tissues. And you really got to exchange the air, Anthony. I mean, I don't know what to tell you. From the healthcare perspective, yeah, when the healthcare perspective that we do, we really go the gamut. My nurse, Barbara, comes out of 30 years of infection control. So we are very specific. We've even gone as far as using a 10% bleach solution, which was the old-time way to wipe things down when I was in the laboratory when we were handling a lot of bacterial infections. So yeah, you've really got to do it, and you got to make sure. The other thing, though, Anthony, more important than that is I think it's important for people to maintain good hygiene. Look, you got to wash your hands. You got to make sure that you sneeze into a hanky and throw it out. I mean, people are cavalier about this. We don't permit that in our facility, nor would I permit it. By the way, I'm down here in Atlantic City, so I'm close to you. I wouldn't permit that in my unit. We open up the doors. We're really big on the air exchange. I think it's really important, Anthony. Okay?
Thank you,
I hope
doctor.
that helps.
Thank
I hope
you.
that helps.
It
God
sure
bless
did.
you,
Thank
too.
you very much.
Okay,
God bless
Anthony,
you.
thanks a lot for the
God
call.
bless you.
Speaking of that, I know you're a stickler about this, and I know your nurse Barbara. Barbara is like the drill sergeant.
Oh yeah. Oh yeah.
So,
Well,
but what can people do to kind
well,
of
you really
maintain?
need look. You need a good air purification system. I mean, that's it. I'm doing this for the whole clinic. I actually have, in addition to that, not only do we have it built into the air conditioner and the heater, I actually have something called a room scrubber, which is a unique situation that gets particles out as small as viruses. So you can be sure I'm on that. And the other thing is, my girls use very good infection control. You're using your mask, you're using your gloves. I mean, you're not cavalier about it, period. You're wiping everything down with the antibacterial and the antiviral tissues and towels and things like that. And of course, the other thing that I think helps in a situation like ours is we use a lot of disposables. So we don't have to worry. We do send out for high blankets and things like that, and they're done in very high temperatures. So, we use a laundry service that's unique to healthcare.
Yeah.
So, I mean, these are the things that you do when you're running a facility. In your home, I would say you want to parallel that, right? You want to wipe things down. You want to make sure that people are washing their hands. You want to limit the amount of people that you get together with. But look, we don't have to give up our social life. That I think has been the worst thing through
Absolutely.
this.
No question.
I think we've heard, look, if you're going out to a great restaurant, by the way, Anthony, there's some great restaurants down here, right?
Yeah, absolutely.
You want to make sure that, we want to keep them in business. So the bottom line is, that while you're there, you're cognizant of utilizing good hygiene and being the other thing is, John, you can't make people be respectful of each other, can we?
No.
That's not something we can make happen.
You're right.
You just
said
have
that
to
earlier,
know
and
it.
you're
We
right.
just have to know it.
Right.
And that's the thing. And I remind people in our facility, be respectful of your neighbor. And if you have a fever or or there's a problem that you might be ill, listen, you're going to be segregated from the rest of our population. And if you have COVID, we're going to tell you to go to the hospital.
All right, we're coming up on our final break of the morning. It's Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Couple of minutes left of the show, so you have time to jump in if you have a question or a comment for Dr. Molly. 855-839-1210. 855-839-1210 is our number here in the studio. With Dr. Molly Fantasia, I'm your host, John DeMasi. We're coming back. More of today's Health Watch after these words. Back here on Health Watch, operators standing by as per usual, and they'll be there after we leave you at 9 o'clock at Innovative Medical. 856-489-0505. 856-489-0505. Call them up, ask them questions, get more information. Most importantly, make an appointment to sit down with Dr. Molly and go over your particular situation, and that's where you really can get the information you need in order to make an effective and more intelligent decision. So do that, 856-489-0505. Check out the web, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And don't forget, we have our Health Watch replay. You missed the show this morning or you caught some of it, you want to hear it all, replay this afternoon, 4 until 5, here on Talk Radio 1210 WPHT. Health Watch is the show. We're going right to the phones. Carmel is in South Philadelphia. Good morning. You're on with Dr. Molly.
Hi, Carmel.
Good morning, Dr. Molly. I love your show. I've been listening to it for years. God bless you for all that you do.
Thank you. And I'm a South Philly girl, so God bless you too.
Thank you, Doctor. Doctor, I had the COVID about a month ago.
Okay.
And I was home. I was like on my back for about 3 weeks, really sick, lethargic, couldn't do anything.
Right.
My problem now is I'm getting my energy back,
Good.
but I can't eat anything.
Yeah.
I just can't eat anything. As soon as I try to swallow something, it just lays on my stomach.
You know,
and it's the most uncomfortable feeling.
I'm sure. And this is not unusual. There are some people that this is happening to. Now, I would tell you that if you were closer, well, we're not that far from you in Marlton. I would come in and get an IV of vitamin C, some nutrients, maybe some amino acids. And there are some liquid kind of diets that we could help put you on to help you over this. But I would urge you to try to eat a little bit every day, much smaller meals, and maybe stay away from some carbs if you can, Carmel. You can't put anything down at all?
Well, I could, but I feel like suffocating. It just stays on my stomach.
I gotcha.
And it's the most uncomfortable feeling. You almost dread to want to eat.
Listen, I want to ask you another question. Are you taking any probiotics right now?
No, I'm not taking anything because I'm not eating anything, and I'm afraid that, they might do me more harm than good.
I understand, but I would tell you that with your meal, I would take a good probiotic. Do you have anybody that can drive you over to us? Maybe come on in for a free consult. I would love to help you out. I think
I would love to come there. I have to see because I don't drive.
Yeah, I understand. And believe it or not, we're quick. We're about, 15 minutes, not even.
I would say so, 15, 20 minutes from
South Philly.
Yeah,
right. Absolutely. I still live in Philly as well. But I'm with you, honey. I think we could help you. And I really mean that. And I have a lot of patients, by the way, from Philly who come in, and I would definitely like to help you. But please, I think look at some probiotics, look at some enzymes. But again, I don't want you to just go to the health food store and pick up anything. I want to help you get the right stuff. Okay?
I think with your help, it would be most beneficial to me. So I'm going to see what I could do to try to get over there.
Please, and I will try to accommodate you. I'm there on Saturdays, and, if you need, we have a late night on Tuesdays and Thursdays. So if you need, me to accommodate your schedule, I will. After all, I know you. You're a South Philly girl. I want to take care of you.
Okay.
We got to be around a long time, Carmel.
Carmel, thank you.
God bless you.
Thank you for the call, and good luck with that, okay?
Yeah, that's a nice call because I know how she feels. That post-COVID, the long haul syndrome is terrible.
Yeah. Let's finish the story
So Harvey.
of Harvey. Harvey's doing well now,
Yes,
correct?
he is. But now he's coming back. He's actually been back once a week, I think, for the last few weeks because I'm trying to get back his stamina a little more and also his, hormonal levels, that kind of thing. But again, when you just think about this, the fact is he had comorbidities before. He still has some of these comorbidities. In other words, hydration isn't holy water, John. You don't leave the hydration chair and now you're walking on water. It doesn't work like that. You gotta maintain a reserve. And when you catch a condition that's viral or bacterial, the idea is you want to get through it as quickly as you can, and then you want to build up your own immune system to fight this thing off as quickly as you can.
What can you say to people? We know we're kind of at the official end of the summer.
Sure.
And September is the time. Remember we were kids? September starts the year because we go back to school.
Exactly.
So September is kind of a time to start over. What can you say?
Here's what I would like people to do. Take a real evaluation of where you are in terms of your quality of life in your particular age bracket and really evaluate that and say, do you think there's some room for improvement? Yeah, I want you to look good. I've got all of the beautiful, Dr. Harvey Glass helped me with everything we can to make you look good. Now I want you to feel good, feel well. My nursing person, Linda, says it's better to look good than feel good, but she's kidding. She says she's kidding. But the bottom line is, let's assess where we are and see if we can improve our quality of life, because I think by improving your quality of life, you're going to improve every aspect of your life.
And that's ultimately what your goal is with patients, to improve the quality of life no matter what the condition is.
Exactly, and where they are. We meet patients where they are. We aren't about saying, don't have any hope. You have a chronic condition, you have cancer. We don't tell you give up your hope. Don't. Because only the good Lord can tell you when it's time to go.
That's a good note to end the show on for the holiday weekend. That's going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by at Innovative Medical, and they can take your call right now and after 9 o'clock and after 10 o'clock and throughout the day. 856-489-0505. 856-489-0505 is the number. Check out the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Don't forget, you can hear our Health Watch replay this afternoon from 4 until 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, Joanne, and the nursing staff, Jess and Crystal, I'm your host, John DeMasi. Thanks for listening. Have yourself a great week and a great holiday weekend. We'll do it all over again next Sunday. Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. Take care.
This program is a paid commercial announcement and in no way represents